Now, Dr. Scott Miscovich is a family physician and a national consultant for COVID-19 testing, and he joins us now live from Hawaii. Thank you so much for joining us. The Tokyo Games officially open today. What are your thoughts on this? Will the IOC be able to manage these games safely?
Thanks, Kristie. Yeah, as you also probably know, I've been on the show. I was the U.S. Olympic testing director for the Olympic trials here in the United States for almost 4 months for swimming, track and field, gymnastics, and rugby. So we had extensive experience testing our athletes prior. Out of all the testing we did in those group events, we had zero Olympic athletes that were positive and did not go on to Tokyo. Now, I do believe that so far there is a degree of optimism because we only have just about 100 athletes that are positive out of 11,000 athletes that will be competing, and they are doing daily tests. Now, I have a little bit of a beef because I have a secondary experience. I was the COVID medical director for the SEC sports colleges, and that was for 1 year, and we had less than 1% positivity. They're using saliva antigen tests daily. I'm surprised they aren't going with the gold standard, the PCR test daily. That would allow someone to be detected before they were spreading. Antigen tests are fine, but that's before they're spreading. So there is a chance we could have some super spreaders, but I do believe the games will go on.
You know, that's alarming to hear that they're using saliva tests, not these more robust tests for the athletes. And it raises a question about super spreading events that could happen in competition. You know, the athletes, when they're out in the field, they're not wearing masks. What is the risk of transmission of COVID-19 during competition?
Now, they are doing pre-event testing for everyone. They do that rapid antigen test right before an event as an attempt to not have someone that is active. Now, antigen tests, again, are very accurate if you're already spewing the virus out of you in many different ways. So they are having reasonable mitigation efforts in play. And as you well know, certain sports like equestrian isn't like a big risk, but there are certain team sports where they had bigger risks. Now, one of the things we did in the SEC, I'm surprised they didn't do, is the athletes had wristbands on that showed the distance they were from an athlete. So when you wanted to do contact tracing, you had clear data about how close and how frequently they were close. Now that takes us to what the risk is with Delta. Much more transmissible for smaller respiratory droplets. So they could spread it just with casual contact for 30 seconds to a minute. So it's a concern. You are actually very right with that, Kristie.
So is this going to turn into a super spreader event?
I don't believe so. I do believe they have enough protocols in play with the daily testing that there still are some loose ends where the people still can sit within 3 to 6 feet of each other in dining and lunch facilities on an indoor basis. So I do think we're going to have some more positives. I do think, unfortunately, there'll probably be some key athletes that will be taken out. But a true super spreader event, we had the Czech team on the airplane that is now being investigated with 6 positives because they took their masks off out of 41. So we're going to see some challenges, but these games will go on and the major medals will be handed out.
I also wanted to ask you about vaccines and the efficacy of vaccines, because yes, vaccines work. They work, but there have been these cases of breakthrough infections, especially with this highly contagious Delta variant. Does this worry you? What does this mean for public health strategies to fight the virus?
Very good point also. The best study we have now is coming out of England, where they had almost 90,000 positive Delta variants. They had a 10% breakthrough in the vaccinated public. Now, we're also getting some more data that shows that we're going to probably have a little higher risk if you've had J&J to break through. Now, very much want to highlight your chances of dying are very unlikely if you've been vaccinated. There are some rare cases, but you are very correct. Now we're going to get more breakthrough with Delta for multiple reasons, slight less efficacy, and also how contagious that virus is. Remember, 1,260 times the amount of virus produces in the human body with Delta compared to the recent other variants. So it is a very big concern. There's going to be a lot of discussion of boosters coming up. And we need to have our CDC push that ahead and not take their time. And I'm a big advocate that we need to start advocating for individuals in our countries to be able to get a blood test, which is available, a spike antibody test to see detection.
Yeah, absolutely. I mean, it's a discussion that's already been taking place here in Asia among some countries like Thailand, Indonesia, the need for booster shots like the Moderna vaccine, in addition to the more traditional vaccines that they've been using. A much needed conversation that needs to happen around the world. Dr. Scott Miscovich, thank you so much for your expertise and your time.